Do Kegels actually work? Hi, I'm Dr. Ty Ahmed, and I'm a board-certified physiatrist who specializes in pelvic health. Did you know that Kegels are not always a good thing? In some cases, Kegels are helpful, but there are many pelvic health issues where doing Kegels can actually make things worse. Before we get into today's educational video, it's important to remember that the best way to know what therapies are best for you is to see a pelvic health doctor and get the guidance you need and a physical examination so they make the appropriate treatment plan for you. So now let's get into when generally Kegels work and the cases in which Kegels can make things bad. Kegels can be incredibly beneficial for certain pelvic health issues, and those generally relate to patients who have weak and loose pelvic floor muscles. First up, that's stress urinary incontinence. This happens when you leak urine during activities like coughing, sneezing, or exercising. Kegels work by strengthening the muscles that support your bladder, urethra, and give you more control over your urination. Next is a situation called pelvic organ prolapse, but only in mild cases. Kegels can help prevent mild prolapse from worsening by toning the muscles that support your pelvic organs. If you're feeling a sensation of heaviness or pressure, Kegels can give you some relief. Another condition where Kegels can help is urge incontinence. That's when you feel a sudden, intense need to urinate. While Kegels can improve muscle control, urge incontinence may also need other treatments. Kegels can also be helpful during postpartum recovery. After childbirth, the pelvic floor muscles may become weak and loose, causing symptoms like incontinence or discomfort. Regular Kegel exercise can help regain muscle strength and improve function. However, it's important to note that not all postpartum patients have a weak and loose pelvic floor. And finally, in some cases, Kegels can enhance sexual function by improving muscle control and sensation while helping overall pelvic floor muscles strength and intimacy. But it is important to explore the root cause of any sexual dysfunction before assuming that Kegels will automatically help. Now let's talk about when Kegels can actually make things worse. This is where we have to be careful because not all pelvic floor issues can be caused by weak and loose muscles. If the issues are actually causing your muscles to be tight, then doing Kegels can actually be counterproductive and cause more pain. One of the conditions where doing Kegels is a bad idea is pelvic floor hypertonicity. In this scenario, pelvic floor muscles are tight and it's like having a tight muscle stuck in a contraction. If you're experiencing pain or discomfort during urination, bowel movements, strengthening the muscles will not help, and it'll actually make things worse because it'll make a tight muscle tighter. In this scenario, going to pelvic physical therapy is a better option to help relax those muscles. Another condition is having a severe pelvic organ prolapse. In these scenarios, the patients can do Kegels, but they may not make a difference, and surgical intervention may be necessary, as well as other options like a pessary. Kegels are also not helpful in scenarios of chronic pelvic pain, where the muscles are tight and overactive, and generally speaking, most patients with pain should avoid doing Kegels before getting an appropriate examination by a pelvic pain specialist or pelvic floor physical therapist. Then there are some conditions that the Kegels just don't help at all, like interstitial cystitis or painful bladder syndrome. Since this condition isn't caused by loose and weak muscles, Kegels won't improve these symptoms, and doing them can be counterproductive and cause more pain. So, when should you be cautious about doing Kegels? In all of these scenarios, always reach out to a pelvic health specialist or a pelvic physical therapist to assess your pelvic floor and guide you to the right treatment. Pelvic health is not a one-size-fits-all situation. While Kegels can be a great tool for certain conditions, they are not always the answer. And if you're dealing with pelvic floor issues, it's important to get the right diagnosis. So be sure to see the right doctor that can get to the root of the problem. I hope you found this information helpful. Remember to subscribe below for all things related to women's health. Thanks for watching, and we will see you next time.